Hi everyone, it's Kim here. Today's talk is about teething. Okay, so the textbooks used to say that babies start teething between 7 and 9 months, but we certainly know that babies can be born with 1 or 2 teeth, and sometimes they erupt in the first month of life. You may have seen babies who are 3 or 4 months of age who have teeth. The average time for teething to start is about 7 months of age. So teeth usually erupt in pairs, and the first teeth are usually the bottom 2 teeth. In the middle, they're called the incisor teeth, but this isn't always the case. Okay, so the first teeth are also called primary teeth, and they're smaller and wider than the permanent teeth. And children usually start to lose their first teeth when they're around 6 to 7 years of age. All right. So it's important to care for the first teeth as they save space for the permanent teeth, and they also help to give the permanent teeth a good start to healthy teeth. All right. So the first teeth also shape the baby's face, they help with speech, and they also allow the child to enjoy a varied and healthy diet. Some babies experience discomfort or pain with teething and others don't. There's no way of knowing who's going to be in which category before the teething starts. So the signs of teething are really quite grey, okay, which makes it very difficult, but over time parents do seem to be, or some of them can work out what signs the baby displays when they are going to start teething. So some babies get really red in the face, or others might have a really watery, much looser bowel motion than usual. I know other babies have no signs at all. Okay, so it does vary. The main sort of things that parents report for teething are when the baby actually just seems to be uncomfortable. So, or there's some inflammation or swelling of part of the gum. There's a general malaise, so a feeling of discomfort or uneasiness or pain. But that can often be the first sign of an infection or other illness too. So you could get disturbed sleep, which is pretty common with new babies anyway. Facial flushing, dribbling, gum rubbing or biting or sucking on the baby's fingers. So it could be a bowel upset, as we said before, or the baby could just be off their food a bit. But just keep in mind that all these signs and symptoms could actually be related to other causes like other illnesses. And if you're concerned, just go to your GP. Okay, so comfort measures for babies when they're teething. Okay, so what I'll do is start with the pharmaceutical preparations and work my way through to the more natural sort of things you can use when the baby's teething. All right, so if you're probably aware that there are lots of teething gels around, so if you are looking at a teething gel, just make sure that the gel doesn't contain benzocaine, which is not recommended for infants. It actually can build up and become toxic. So there's also baby paracetamol, which is used for pain, and just be guided by your pharmacy with regard to dose, and don't exceed the dose because that can be harmful. The other thing is Nurofen, which is an anti-inflammatory, which can help with the swelling and the redness of the gum. So once again, just be guided by your pharmacist and don't exceed the dose for that one because that can be harmful too. Okay, you may have seen the teething necklaces that some babies are wearing, and to decrease the discomfort of teething. And I did look at the information on this, and at this stage it says that there's no information or evidence that they work. And they can be a risk. There can be a risk of actually the baby swallowing the clasp, or the baby choking on the little beads, or even strangling the baby with the necklace. So some people, some parents find oral homeopathic creams or drops really useful, and these are available in the large pharmacies. So once again, you can talk to the pharmacist or the naturopath there, or if you have your own naturopath or homeopath, then have a word to them. They'll be able to help you out. So the simplest thing to use is cold, but not frozen. Okay, so if you've got teething rings or a wet washer that you pop in the fridge and then give it to the baby to hold if they're able to hold, then they'll put that exactly on the gum where they need it. The other thing you can do is, if the baby is over 6 months and having solids, put some fruit like watermelon or rock melon or kiwi fruit or honeydew melons in the fridge, and just cut it in hand-sized pieces so Bub can hold it, and they'll often suck or chew on that to give themselves a bit of comfort. If you decided to give the baby a dummy, then you could use that. Some babies just chew on their dummies to help themselves become more comfortable. If you are using a toy that's made of rubber or plastic or any other material, once there's a break in that fabric or material, the toy needs to be thrown away, because what can happen is that can be the perfect site for bacteria to enter, and moisture and mold can grow on the inside of that toy. So just throw that one away once there's a break in the fabric. Okay, so babies are really very clever. You'll often see them just putting their fingers exactly on the place where the tooth is starting to come through, and they do that to self-soothe and comfort themselves. So healthy babies know exactly where to put their finger, or the finger, the thumb, or the little knuckle to make themselves more comfortable. Okay, so the next videos will be about caring for the teeth. So I'd really like to say thank you so much for listening in. I hope that that's useful, and feel free to drop any comments in the section below. Okay, have a lovely day. Bye.